Welcome back to TV5 News at 9. Joining us this morning is a real treat, Dr. Christian Hyde from McLaren Proton Therapy Center. Thank you so much for being here. How are you, doctor?
I'm doing great. How are you doing?
I'm doing well. Thank you so much. Well, we all know October is Breast Cancer Awareness Month, very important month, and today we are talking about proton therapy treatments for breast cancer patients. So first of all, let's start off with, when should women start getting mammograms, doctor?
Right. So the American Cancer Society now recommends that women start screening at age 45, unless you have a strong family history, like maybe your mom had breast cancer at 45. If that's the case, you would start at 35, 10 years earlier. Otherwise, women are encouraged now to start mammogram screening once a year at age 45.
And doctor, when someone does get that diagnosis that they have breast cancer, what treatments are available for breast cancer? It is not a death sentence. There are so many treatments that are available now. Tell us about those.
Sure. So it used to be if you had breast cancer, you were getting a mastectomy for sure. Everybody got a mastectomy. And that changed around the 1980s when we found out that a lumpectomy with radiation was just as good. If you have a lumpectomy and radiation for a tumor that's small enough to be removed and still have a decent breast, then you can keep the breast, which is a lot easier on the patient, physically and psychologically. It's a smaller surgery. You fall asleep with a breast, you wake up with a breast. Okay. It's much easier than waking up with no breast.
Yeah, that's great news. We definitely want to keep those. Well, tell us about this, doctor. How does proton therapy actually differ from other treatments?
Sure. So proton therapy is particles. It's like a bowling ball or like playing pool, where you throw the particle, or in this case, in pool, you send the cue ball into the rack of balls and they scatter, and you can see where they go. And if you'll allow me to share an image, I think that will help me explain. X-ray therapy is different. X-rays go in one side of your body and out the other, which is great when we're doing imaging, but not so great when we're doing radiation therapy. So X-rays, they go in the front, they go out the back. And sometimes that's necessary, but with breast cancer, we really don't want the X-rays to go deep inside the patient. So X-rays on the left here show how the beam in pink goes in the front, out the back. Protons are different. They're like these little billiard balls. They go in where we tell them to go, and then they stop. They stop inside the tumor. They don't go out the back of the patient unless we want them to. And this helps patients like this. This is a young lady in her 40s who was treated with breast cancer, and because she was young, it was really important to avoid the heart. We know that radiation can damage the heart. It can increase the risk of heart attack. And so by avoiding the heart, we're able to help keep her free of cancer, but also free of heart disease. And you can kind of see here in red where we want the X-rays to go. It's in the lymph nodes and in the breast tissue, but we don't want it to go inside the chest. We don't want to hit the lungs or the heart any more than absolutely necessary. And protons really help us do that. And so it's really a new tool to fight cancer. It's not the only one, but it's, to me, the most exciting one that we have available right now.
It sure is, and it's just targeting that treatment site right there, which makes it, that's so ideal, doctor. Love to hear about that. How can people find out more information to see if proton therapy is right for them?
So we do have a 1-800 number. It's actually 855-MY-PROTON. That's 855-MY-PROTON, MY-PROTON. And we also have a website, McLaren.org/proton therapy.
Anything else, doctor, you want to tell viewers about breast cancer or proton therapy that we have not talked about?
I think you mentioned it earlier that there's a lot of hope for cancer in general, and especially breast cancer. It used to be, like you said, a death sentence. It's more of a problem that we can solve for a lot of people. There are those we still can't cure, and that's why early detection is so important. So if you haven't had your annual mammogram, please go out, get the mammogram, get screened. Don't be left in the dark about your breast health.
That is a great message. Do not hesitate. Make sure you get your mammogram and get screened. Thank you so much for joining us this morning, doctor. We appreciate it.
You're welcome. Thank you.
You're welcome. You're so welcome. For more information about this topic, please head on over to the hot link section. That's at WNEM.com.